Pharmacology of the cardiovascular system, arrhythmias. Occasionally, an area of the heart other than the SA node will initiate an impulse that will be followed by a premature contraction. Such an area is known as an ectopic focus. An ectopic focus may be stimulated by localized ischemia, exposure to certain drugs, elevated stimulation by both sympathetic or parasympathetic divisions of the autonomic nervous system, or several diseases or pathological conditions. Occasional occurrences are generally transitory and non-life-threatening, but if the condition becomes chronic, it may lead to either an arrhythmia, a deviation from the normal pattern of impulse conduction and contraction, or to fibrillation, an uncoordinated beating of the heart. Severe arrhythmias can lead to cardiac arrest, which is fatal if not treated within a few minutes. Abnormalities that may be detected by the ECGs are shown. Antiarrhythmic medications such as sotalol, diltiazem, and amiodarone are used to treat arrhythmias. Sample arrhythmias. In a second degree or partial block, one half of the P waves are not followed by the QRS complex and T waves, while the other half are. In atrial fibrillation, the electrical pattern is abnormal prior to the QRS complex, and the frequency between the QRS complexes has increased. In ventricular tachycardia, the shape of the QRS complex is abnormal. In ventricular fibrillation, there is no normal electrical activity. In a third degree block, there is no correlation between atrial activity, the P wave, and ventricular activity, the QRS complex. Heart failure. Heart failure is a condition in which the heart can't pump enough blood to meet the body's needs. Right-sided heart failure occurs if the heart can't pump enough blood to the lungs to pick up oxygen, whereas left-sided heart failure occurs if the heart can't pump enough oxygen-rich blood to the rest of the body. Heart failure is a very common condition, with over 5.7 million people in the United States having this chronic condition. There is no cure, but the symptoms can be managed for several years with lifestyle modifications and several different types of medications. Causes of heart failure include hypertension, myocardial infarction, and other cardiac and respiratory diseases. Common symptoms of heart failure include peripheral edema and shortness of breath that occur as a result of fluid overload. Many patients are treated with diuretics to manage the symptoms of fluid overload and with antihypertensives to manage the blood pressure. Other medications such as digoxin and dobutamine may also be used to increase the contractility of the heart. Processes related to cardiovascular and renal medications. Nursing. An understanding of the mechanism of action of a cardiac medication will help medics choose the proper assessments to perform on a patient. It is important for a medic to complete a full cardiac assessment to fully understand the health status of the patient, the safe implementation of the medication, and the expected effectiveness of the medications. Many cardiovascular medications alter a patient's blood pressure or heart rate, such as antiarrhythmics, cardiac glycosides, antihypertensives, or diuretics. Therefore, it is important for a medic to assess a patient's blood pressure and heart rate prior to administration. Medication parameters are often included in the order by a healthcare provider. For example, a common medication parameter is to hold a beta blocker if a patient's heart rate is less than 60 beats per minute. Additionally, anti-arrhythmic medication will alter the electrical conduction of the heart, so intermittent or continuous ECG monitoring may be required during initial therapy or dose changes. Electrolytes can play a large role in cardiac conduction and muscle function. Medications that alter electrolytes, such as loop diuretics, require a review of laboratory values before administration. Loop diuretics, such as furosemide or Lasix, often cause a depletion of potassium. If a nurse administers a loop diuretic to a patient who already has low serum potassium levels, called hypokalemia, worsening symptoms of hypokalemia will occur, which can cause a life-threatening arrhythmia. Monitoring kidney functions is also important when administering many cardiovascular medications. For example, diuretics can cause renal injury. A medic should be aware of cardiovascular medications that are affected by impaired renal function or cause renal injury. In addition, a medic must appropriately assess and report abnormal laboratory values such as worsening serum creatinine and glomerular filtration rates, or GFR. It is important to assess for signs of dehydration, as well as intake and output in patients taking diuretics. Anticoagulant medications cause serious risk for bleeding that can be life-threatening. Prior to administering medication that alters a patient's coagulation, it is important to assess for signs and symptoms of unusual bleeding or bruising. Laboratory values such as INR, PTT, or platelets may also require review prior to administering an anticoagulant medication. Any new abnormal lab values or signs of increased bleeding and internal bleeding should be immediately reported. Implementation. Before administration of any cardiovascular medication, it is vital for the nurse to determine if this particular cardiac medication is safe for this patient at this time. For example, if the patient's heart rate or blood pressure is below the anticipated parameters, the medication should be withheld and the prescribing provider notified. It is also important to consider the effect of the medication before administering it at the ordered time. For example, if a diuretic is prescribed before a patient is sent to a diagnostic test, the patient may be disrupted by the need for the patient to urinate, and the dosage should be scheduled for a later time. A more significant safety concern arises when a patient who is scheduled for surgery is prescribed aspirin or an anticoagulant. The medic should consider these types of upcoming events before administering medications as they are ordered. Evaluation. It is always important to evaluate the patient's response to a medication compared to what is expected. Many medications require dose adjustments to produce desired effect. For example, IV heparin is administered based on a protocol that requires dose adjustment based on PTT or APTT lab results to achieve therapeutic range and avoid overdosage that can cause life-threatening bleeding. It is also important to evaluate the patient's understanding of the purpose and proper use of their cardiac medications, as well as when they should notify their provider of changing symptoms. Additional patient education before discharge home is often required, especially if new medications are prescribed. Medics should continue to monitor a patient's blood pressure, heart rate, intake and output, edema, or other cardiac assessments to evaluate if ordered cardiac agents are effective or if further treatment or dosage adjustment is required. The patient should be continually monitored for potential adverse effects of medication, some of which can be life-threatening and require prompt notification to the prescribing provider.